We'll start with Senator Becker. Okay, we'll go with Senator Toms. Okay. Population growth. Optimum population percentage growth. Okay. Representative Rican. Okay. Okay. There's clear. She defers. Actually, there is context. Representative Crouch.
Without knowing the context, I really can't.
We can't hear.
Okay. The correct answer is 0. In case you want to know. Okay, it's your turn now. So I'll need the first one. I'll send you all an email explaining what that is. What we're going to do is the first topic. The name is Don Motley, and the topic in 5 words or less, to use 4, right to work pledge. Oh, Don's right up here in the front. I'll tell you what we'll do. Instead, you can stay right there if you like. I'll hand the microphone to you. Maybe.
My personal pledge to the Indiana State Senators and Representatives. As a citizen of Indiana, I am personally against right-to-work legislation in our state. It was passed once and repealed. Nothing has changed. We, the people, do not want it. Therefore, I will do everything within my power to make sure those that vote for right-to-work legislation will not be reelected for another term. Signed, Don Motley. And something very recent in the news that everybody, I think, knows about. Twinkies maker Hostess Inc. files for bankruptcy. Hostess Brand Inc., the maker of Wonder Bread and Twinkies, refiled for Chapter 11 bankruptcy protection Wednesday, just 2 years after emerging. People familiar with the matter said the company is facing a crunch with more than $860 million in debt, high labor expenses, and rising ingredient costs. Hostess Breads employs about 19,000 workers and operates in 49 states. Annual sales are about $2 billion, according to the company's website. 22 right-of-work states, Hostess operates in all of them. It's the second time that the bankruptcy in a decade that they have filed. So my question there is, why does Twinkie have to file bankruptcy if they're operating in a right-to-work state, 22 states of the 49 that they operate in? Thank you.
Thank you. Didn't use this full time, so that's great. Now we have up to 1 minute for legislators. We'll start with Senator Becker.
Well, this is an issue that actually started last year in the House, and it's now in both bodies. We don't know yet what the bill language will be. It's on second reading in the Senate. I'm not sure if it's on second reading in the House yet or not, but I think it is. It just got there, so there will be amendments to the bill, potential amendments. I guess personally I would like to see a referendum on the issue. Because then it would be an issue that the people could truly decide on throughout the state of Indiana. And I think that would be very important that we actually hear from people. You know, I've looked at studies on both sides of the issue. I actually contacted the National Conference of State Legislators.
Time. Senator Toms.
So much for that.
Thank you. Too bad we could have more turnout here today. Folks, in answer to your question, I'm going to tell you up front, I think everybody pretty much knows where I stand on this thing. I've been very vocal about it. I think the only people on the planet that may not know where I'm at on this might be folks in Pakistan. I don't support right to work. The issue is complex, and it's somewhat simple at the same time. I'm going to tell you, I didn't go up there to the State House to see if I can inflict any kind of damage or hardship on our citizens. And for me, the working class people, whether they're union or non-union, are folks that are struggling to make ends meet. They're the ones that oil the wheels of the machine. They're the ones that keep things going. The wealthy do well for themselves, and the poor people have programs for them. But the working class has nothing geared to help them. What they earn it on their own.
Time. Thank you. Representative Regan.
Thank you, and I want to thank everyone for coming out today. This is great. I will tell you, I have distributed as many of these copies of letters that give you an idea. I think, first of all, it is from the top level. The governor, at one point in the letter, states that he does not support right to work. The second letter that I gave you is from this last week. We must make sure that the referendum is, in fact, passed so that it gives people the opportunity to vote. And that's going to take everybody working so that there is no parliamentary procedure that keeps this from passing or coming to a vote on the floor of the House. So, folks, you need to let your legislators know. Thank you.
Thank you. Next is Representative McNamara.
Thank you. I echo a lot of the same sentiments that Senator Becker did as far as trying to look at both sides of the issues. I've heard from hundreds and hundreds of people on both sides, and I appreciate everybody who has sent their input to me, made their phone calls, showed up at the State House, and put their input in. I will tell you, I'm not in favor of a referendum piece. I would not vote for that. I was elected to make the tough decisions, and I don't feel that is something that I should put off on you.
Okay, let her speak, please. Ladies and gentlemen, let her speak, please.
A wise man once told me it's okay to disagree, but it's not okay to be disagreeable. So, with that said, on Tuesday, I'll look at the bill, I'll look at what's been put up there, and I'll make my decision.
Thank you. Next is Representative Crouch.
Thank you. And thank you all for coming out this morning. In terms of a referendum, the Indiana State Constitution does not allow a referendum on policy decisions. It allows language that will allow referendums on constitutional amendments and will also allow the legislature to enable locals to do referendums. But constitutionally, we cannot do a referendum on this issue.
Thank you. Thank you. We appreciate that. The next lucky drawing winner is Joe Ballard. I see Joe over there. And the topic, in 5 words or less, is Senate Bill 210, solid waste legislation. Yeah, please come up to the microphone. You have 2 minutes to make your case.
Thank you. I'm not here to speak about right to work. Then I'll take my 2 minutes, and then you can have the rest of it. I'm Joe Ballard, Executive Director of the Vanderburgh County Solid Waste District. We send all of you our board minutes and other materials so that you will be familiar with our programs and services and how we spend our money. I'm here to speak about Senate Bill 210, which I've spoken to Senator Becker about earlier. Senate Bill 210 would not allow solid waste districts to be funded by property taxes, which many are. In fact, Posey, Warwick, Gibson, and Spencer County solid waste districts are all funded either entirely or in part by property taxes. The only district that is not in Vanderburgh County, which is funded by fees from the landfill, is Vanderburgh County. The other districts in this area do not have a landfill to fund their programs. If this bill passes as is, programs and services would not be provided, and the public would not be happy. public likes recycling programs, hazardous waste programs, and trash service, which it's used to pay for in some of the other counties. This would also take away some measure of local control. All solid waste districts directors report to a board of locally elected officials. The mayor, the 3 county commissioners, a representative from city council, county council, in our case, a person from the town board of Darmstadt. This board governs our programs through our monthly meetings. They also must approve our budget, as must the county council. These are true examples of local control. This bill would take that away. Again, the public likes and in fact demands our programs and services. When 1,800 vehicles come to the Vanderburgh County and Posey County Toxaway Day, you know there's a need for it, and it is popular. When about 1,000 cars come to the Vanderburgh County Electronics Day, it is popular, and when 500 cars come to the Holiday Recycling Day, you know it's popular. So,
Time.
Thanks.
Pretty good. Thank you. Thank you. Now a response from legislators. We'll start at the other end this time with Representative Crouch.
Are you in favor of the bill or against? I'm not.
Against the bill as it is written. I would like to see it maybe be sent to a study committee, but we are opposed to taking away property taxes to fund solid waste districts.
Okay.
So we're opposed to that part of it. There's some things in there about education, which are okay, and we can deal with those, but the funding of this is what we're opposed to.
Thank you.
Okay. Next, Representative McNamara.
Not having seen the bill, or this is the first time I've heard of it.
It's in the Senate and has been heard, and I think Chairman Kenley is holding it for vote for next week sometime.
Okay, if you just keep us apprised of the situation and let us know, I appreciate it. Thank you.
Thank you. Next, Representative Regan.
Thank you. Joe, if you can keep us, again, let us know how it goes. I know that the solid waste district is extremely important. And I'd like to clarify that with all respect to Representative Crouch, in 1955, when the General Assembly put a question on the time zones and daylight savings on the ballot for information and guidance to the members of the 19th General Assembly, only advisory and non-binding. That's the kind of referendum we need.
Thank you. Next, Senator Thompson.
Thanks, Joe. Too. There's about 1,000 bills introduced every session, and so I didn't know about this bill either. How else would they fund it if we didn't do it that way? I really don't know. So,
in Vanderburgh County, we are funded by fees we collect from the landfill. Other counties around us don't have a landfill to do that.
How would they fund it then?
They would not.
Okay. Thank you.
Okay.
That's the big question. I guess they'd fund it through other user fees, county option income tax, that type of thing. Which
Thank
that's
you.
not easy. So.
Senator. Good luck with that. Senator Becker.
Am I, is this on or is it not on? I'm on, okay. I did talk to Joe, I think it was last week, and I've been following. I know it's before the Senate Finance Committee. I guess I don't understand the purpose of the bill. I know it's Senator Gard's bill, and it just seems to me like you have to have recycling programs. I don't understand if you don't have it on property tax. User fees are the same thing as it's still money. It's still going to cost us. So I don't understand her rationale. As the bill currently stands, I would be opposed to it, and certainly we'll look to see maybe they're going to do something else with it or come up with another option. But I just don't. I don't see the purpose. We have some of the lowest taxes on property in the country. I mean, the governor brags all the time about how low our property tax is. I don't think we need to take this service away from the people, because I think they certainly. How many of you here support having your trash picked up and are willing to pay for it through your property taxes?
Thank you. The next lucky winner. The next lucky winner is Ray Brown. Please make your way to the microphone. His topic is a fairly simple one: tax. Bill number is House Bill 1358, and Senate Bill 216. You have 2 minutes.
Okay.
Right now, there are 3 separate groups of taxpayers in the retired group, and the 3 groups are based on who your employer was. The railroad employees get about $45,000 deduction on their retirement. Social Security about $25,000, and government employees get a $2,000 deduction. So you can see there's quite a bit of inequity, and it's based on who your employer was. Right now, over the years, we've had several bills to try to create parity between these groups, but the bills right now, there are 2, one in the House, House Bill 1358 and Senate Bill 216. They don't create parity, but they make it better. Good, thank you.
Macro, was not expecting that. You got a whole minute left almost. We'll go to our legislators and start on the Senate side with Senator Becker.
Ray, I think I have always supported this piece of legislation. As you know, I think we do a disservice to senior citizens, and we actually encourage them to reside outside our state because of some of our tax policies on pensions. I know there was a study committee that was supposed to look at this past session as a result of another bill that we authored and passed during the last session of the General Assembly in 2011. Do you know what the recommendation was?
There is an impact statement which...
No. It did nothing. They didn't make any recommendation.
Okay, they didn't make any recommendation on it. Did they even study it?
Yeah, they had hearings, but that's all it was. People testified and...
Okay, so they didn't make a recommendation on it. Did they indicate what the fiscal impact would be on the state?
In the Senate bill, that they
216, was it?
Yeah, there's an impact statement. The
Time.
House bill is
We'll now go to Senator Thoms.
Okay, thanks, Ray. I did agree to sponsor that bill. I know Senator Skinner has introduced that, and I have agreed to go on that bill with him. And I do appreciate that for the federal employees, they don't get Social Security; they get that pension, and it is taxed. And I understand it is not fair. I know we're in tight money times too, but fair is fair, and so I do support this bill. So.
Thank you. Next is Representative Regan.
I'll just say ditto to what Senator Tom said.
I won't even have to use the watch on it.
That's right.
Next is Representative McNamara.
I agree with all 3.
Okay. Next is Representative Crouch.
Thank you. I actually am on House Bill 1358, and just for the audience, that has to do with taxation of civil services annuities. It increases the maximum state income tax deduction for federal civil service annuity income from $2,000 to $5,000, and it also provides that the deduction is also available to a surviving spouse.
Thank you. We'll move on to another topic now. The next lucky winner is, I'm going to try to pronounce this. I think it's Jim Bratton, Bratten. Please make your way up to the microphone. I don't see anybody moving. Oh, okay, he's coming. His topic is Healthcare Compact, and the bill number is the House Bill 1269. Right before he gets there, I'll remind you that we do have donation jars up here. You have 2 minutes.
Thank you.
Go ahead.
First of all, I want to thank all of you from the Senate side and the House side for taking the time to come and talk to the people you work for. Appreciate it. Last summer, I put together a healthcare compact team for the state of Indiana. This compact has passed in Georgia, Missouri, Oklahoma, and Texas. What it does is it changes the bottom determination about who decides on your healthcare decisions. Essentially, HB 1269, which is in Representative Tim Brown, Dr. Brown's committee. Susan, you're familiar with it. What it does is it brings the decision making back to the state of Indiana from the federal government. So it allows you to bring things closer to the lowest common denominator, which is you people in the House and the Senate and your constituents out in your districts. The state gets to decide who pays, who doesn't. Indiana's bill from the feds for Medicare and Medicaid does not change. It just allows Indiana to make the decisions, not the federal government. It allows for the purchase of health care plans and benefit plans across state lines. When I worked for Chrysler before I retired, I moved from Michigan to Pittsburgh. I had to leave my Blue Cross Blue Shield plan in Detroit, where I moved from, and I had to pick up Delta in Pittsburgh because I couldn't buy BCBS in Pittsburgh because Chrysler was hindered from doing so. This will allow companies to shop for plans, make it cheaper, and open up a whole marketplace. If some of you saw a town hall back in 2009 when this was being debated, the healthcare issue, a lady who owns a small business in California was only allowed to buy 6 plans out of 113 she could choose from because the state of California only allowed 6. So please, when it comes to the Health Committee, support HB 1269.
We'll now have responses from legislators, and we'll start on the House side with Representative Crouch.
Thank you, Jim, and I did get your email regarding this, and I appreciate the work you've done, and I would be supportive.
Thank you. Next, Representative McNamara.
Sorry. Not being familiar with the bill, but just listening to what you had to say and reading the digest, it is something that I can support. Thank you.
Thank you. Next is Representative Regan.
Thank you. I am still in that situation of trying to study all about the exchanges and the healthcare compacts, and I do agree that we ought to have as local controls as we possibly can, with the state being a driver. I like the idea of going across the state boundaries for exchange. I support all that. I'm not at the point to endorse any kind of bill at this point.
Thank you. Next is Senator Thomas.
Thanks, Jim. I know you've been working on this issue for well over a year probably, and I know you put a lot of effort into it. And I am a big supporter of states' rights. Quite frankly, and I don't mean to be derogatory to any federal legislator, but the federal government, I don't know if those folks sometimes could find their own food dish anymore. So I would appreciate that we make our own decisions here. I think we're quite capable of doing that. So, yeah, I support that.
Thank you. Senator Becker.
I know, Jim, you've done a lot of work on this, and I appreciate your email, and I think the decision should be left up to the states.
Okay. Thank you. Thank you. The next lucky winner. The next lucky winner is Frank Coleman. Frank Coleman. Please start. There he is. Please make your way to the microphone. His topic is Teachers Union. You have 2 minutes.
Thank you. I have several family members in the EVSC, and along with all across Indiana, teachers unions are allowed to have what I would consider a right to work ability, where they can opt to be in the union. The ETA currently, I'm very proud of our EVSC. I'm very proud of our ETA board. They have approximately about 1,400 members of faculty and staff teachers here in the EVSC, and they've not lost enrollment. They've been a right to work perfect subject and kind of a test subject to see if it would work, and it has worked. They've kept their enrollments. And so what I would urge and just ask other unions to do, because I think there is a place for unions. I think that without unions, this country would not exist, okay? But I also think that just like my friend Corey Kearns, he's a union organizer for healthcare and nurses in Chicago. They just overturned their union boss because he just gave himself a $1.7 million payout before he froze all the union workers' pay. Now, we don't need this. You as workers don't need this. And the EVSC and the ETA has been working very good together, and I would suggest on a local level, we have great unions here, but I think we need to revise what we have, and I think we need to that other unions need to just kind of look at what the ETA has done, and I think that right to work on a state level, I support it.
Responses from legislators. This time we'll start. I forgot where we started last time. How quick we forget. Started with you? Okay, we'll start at the other end. Oh, we have a new person. Whoa, he snuck in. We will start then with Representative Bacon. You have 1 minute.
1 minute. Am I on? Now it's on. Better. Okay. I'll turn it up. First of all, I want to thank all of you for being here. I'm really not going to try and respond to it. I don't think that was a question. It was just a response to that. But I want to thank all of you for being here. I apologize for being late. Some of you know my sister was admitted to the hospital last night. Excuse me. And she is improving and doing better this morning. So I did get her. I am really happy that everyone's here for this forum so we can discuss the issues that everyone has, and I really don't want to respond to Mr. Coleman's, because like I said, I think it was just a response to him, not a question. So
okay,
I appreciate it. Thank you.
Thank you. Next is Representative Crouch.
If an organization provides value to their members, members will want to pay dues.
Exactly.
Thank you. And next is Representative McNamara.
I work for the EVSC and have been a member of the ETA early on. In administration, you are not a part of the teachers union. And fortunately, through the last few years, there's been a good relationship between administration and the teachers to be able to negotiate some miraculous things for the EVSC. Equity Schools is probably the one that's touted across the nation of having that corporation with its union be able to work together. Other examples, if you look at the value, I believe I've asked in the past, about 90% of the teachers in the EVSC belong to the teachers union. I know when we were talking about a lot of the discussions last year, when we were up in Gibson County, only 2 folks did not belong to the union in those school corporations. I believe it was South Gibson. Ron would know that. And so there is value, and you can see that people still...
Time. Thank you. Representative Regan, please.
Well, first of all, I think we've all settled the issue of the schools and school corporations, and that's really not the issue of right to work today. But let me comment on that, because I very recently had a discussion with a gentleman who, not in the school corporation, but in another school corporation, was charged with, he very active in his union. He was to represent someone not a union member in that school. She demanded that he represent her. She didn't want to pay fees, and she said, if you don't do a good job, I've got a right to also sue you. I should tell you, that's not the kind of spirit and attitude that we want to foster in our unions. They were successful. Did she ever come say thank you? Did she ever have anything to do with them again? No. That's not what we want. That's what will happen with right to work.
Senator Tom.
Yes, thanks. I know some folks support the right to work, and I fully appreciate everybody's opinion on this. I really do. I don't take this lightly. This has kept me awake through the nights. This is a very, very important issue, and I put great importance on it. But I tell you that what we're talking about here is affecting people's lives. Here's the way I see it, folks, and this is from a very pragmatic standpoint. We have a sector of our society that maybe makes better than average wages and benefits. To me, it looks like we're seeking to bring them down a notch. I'm thinking, wouldn't it be better if government was working to elevate everybody up one notch from their standard of living now? Wouldn't it be better? Wouldn't it be better if we was trying to advance large corporations, small business, and working class, everybody up one more level? You know, last session we had a bill to decrease or reduce the corporate income tax, and I supported that by 2%.
Time.
Just a minute.
Time. I'm sorry, sir. Time. Next is Senator Becker.
Let me just complain about the format. I don't think that this is a good format at all. Jim said to take it up with the League of Women Voters, so I'm doing so right here and now. I mean, I don't think you're allowing time for people to even really discuss issues to the extent that they should be discussed if you're actually asking for an answer to something. We need to be able to have give and take on the issue and ask questions and things like that. And I just don't think that this is a good format for anything.
Thank you. If you like those, you may still have some of your speaker request forms. You can write down your comments about what you think about the format on the back of those. Leave them up by the counter here somewhere. So if you want to complain, please write it down and set it up here, and we'll have a look at it. Thank you. But for today, we're going to use this format.
She's from the League of
I'm from the League of Women Voters, and we've always used this format. I think that the thing that's different today, we've always used the format where all that one topic was covered, one topic was dealt with, and then all other topics were dealt with before the other topic. At the end, I mean, we've only got like 4 more questions up here, and we've got another hour and 15 minutes. So after those questions that are not right to work are dealt with, then all the rest of the questions have to do with right to work, just to make you feel a little better.
Okay, thank you. What we'll wind up doing now, we're not going to really debate the format today.
But as far as how much time they're allowed to speak, a minute, that's not something the League of Women Voters decided.
Who decided that?
I don't know, Jim.
It was a vote.
Take it up with Jim.
Actually, if you like, you can complain to me all you want. We voted on doing it. That's the way we're going to do it. If you don't like it, you don't have to like it. All you need to do is live with it. So what we're doing now is taking away from anybody that wants to speak, because when we get done, we're going to be done. So if you want to speak, you need to kind of get with the program. The next speaker, the next winner is Steve Herm, H-U-R-M. His topic is hiring family members in politics, nepotism. Please, there he is. You have 2 minutes. Make your case, please.
2 minutes. Does anybody support hiring people that are related to them in politics? Good. Yeah. Let's talk about right to work. Last week, last week in the governor's State of the State speech, he said that Indiana is looking at a high-speed rail system for Indianapolis. And in his own words, the governor said that, that people from the city of Indianapolis should have a say-so in the matter, and he agreed that they should bring the thing to a referendum on high-speed rail for Indianapolis. And he also said that people should decide if there's a value in this service and they should pay for it. So my point is that the governor believes that on something like this, the people should have a right to know about it. And he also says that if somebody is giving you something of value, you should pay for it. If right to work were to pass in the state, people would get benefits from their unions. They would just have the option of whether or not to pay for it. This is wrong fundamentally. This is un-American. This is not what the people wanted. Also, nobody at this table ran on a pro right to work platform. The residents of the state of Indiana have no say-so on this matter. Representative McNamara, I understand that you have a job to do. I understand that you are my elected official. Hi, I live on the west side of Evansville. Nice to see you. But I do believe that people should have a say-so in this process. And the freest way to do this, if you decide that you want it so bad, let the people decide. Because you know what? The more people in this room, the more people who hear about this, the more people oppose it. So I do think that everybody in the public should know about this if the residents of the state of Indiana agree that we want right to work.
Time.
So be it.
The time is up. Thank you. here's your chance again. This is the third time you get the chance. So hopefully you'll have within 3 times to talk about the same topic already. You know, try not to repeat yourself. We'll start with Senator Becker this time.
I think we've already discussed. Sorry about that. As I said before, I do support a referendum, whether it be advisory or otherwise. I think that this is an issue that the people ought to have an opportunity to vote on, because as he said, nobody in this room ran on the issue, and so I think for that reason alone, including the governor, that we ought to allow people to have an opportunity to have input on this.
Yeah. Thank you. Senator Tom.
Well, I tell you what, I think it's great that we have this opportunity to get together here and listen from folks, that hear what they got to say, see the expression on their face, see it in their eyes, hear the tone of voice. This is what I like about it. I'm sorry that we don't have more time to be able to express ourselves and exchange this back and forth. I'll tell you what, I brought a warm coat with me, and if anybody in here that wants to talk to me after this thing, we can get out in the parking lot, who supports right to work or against it, you can meet me out there and we can talk till the room comes up. Thank you.
That's right. Thank you. And next, Representative Regan.
Thank you. I have a couple of, I guess it's big sheets of paper if you all want to hold them up later on or afterward. It just basically reiterates that there is no correlation between right-to-work states and non-right-to-work states in economic development and personal income growth. None. It's all over the board. Don't let anybody tell you otherwise. Second of all, wages do go down. Health care is a threat, your health insurance and pensions. You're on the right side.
Like Senator Becker, I've already suggested my opinion on the referendum piece. I will continue to listen to what my constituents say. I said I had hundreds of calls on both sides, and so I appreciate the input I've had from both sides, and when I hear the bill on Tuesday, again, like I said, I'll make my decision.
Thank you. Next is Representative Crouch.
Thank you. I appreciate you bringing up the gentleman. Where is he? Okay, thank you. I appreciate you bringing up the public transit bill. It's a bill that we heard in Ways and Means. And the public transit bill does allow for a referendum because in the counties that it's going to be affected, because the voters will be deciding on whether they want to raise their taxes to support a transit. So that's why that referendum is proposed in that bill. Thank you.
Thank you. Next is Representative Bacon.
Thank you. I'm going to take the minute to, since I wasn't here to begin with, to give you what I feel is that when this came up last year, and this has been said, we didn't run on this. Never heard about it until I walked into the State House last year. It was the first time I heard about it, period. And I voted against it last year because of that reason. Not for any one or any. I knew nothing about it. Didn't know the issue, had not studied the issue, had not vetted the issue, and it wasn't one I wanted to discuss that time without doing that. So I did do it that way. Since then, I spent my summer doing my homework. And I went around to my community and my neighbors and my businesses and talked, and the industries and manufacturing, and learned about the issue and in my district. So the issue that I have raised with it and talked to people about is what it is in my district. I will continue to do so until it comes to the floor to make the vote. And I will make the vote based on what my constituents want in my district. Thank you.
Time. Good time. The next lucky drawing winner is Steve Barnes. Please start to make your way toward the microphone. Okay. His topic is, who will pay for non-union members' apprenticeship training and drug testing? This is House Bill 1001 and Senate Bill 269. You have 2 minutes.
Hello. My name's Steve Barnes. I'm the business manager for the Roofers Local here in Evansville. We all the unions have drug testing, and we have a fund to pay for that. So if they don't have to pay dues, are they going to have to pay into the drug fund and our apprenticeship fund, or is they get the free load on that also?
You've got time. You want to make? Okay. Thank you. Responses from legislators. I think we start with, I forgot again. I think we start this time with Representative Bacon. 1 minute, please.
I guess if I didn't show up, you forgot me.
I just forget which side it is.
That's all right. Thanks, Jim. That's a good question. I own a healthcare delivery company, home healthcare equipment. We're required to do drug testing on all of my employees who have anything to do with home deliveries in anybody's home. That's not the same as what the unions have and the trade unions and so forth and take care of it. So I'm not real sure what the answer is. I just want to tell you what else is out there in the other thing. And this is also for those who have CDL drivers. There's random drug testing. The employer pays it. And I'm the employer. I own the company. I have 25 employees. And I'm in a random drug testing, and they bring it up. They go out and do it because it's the law there. And I, as the employer, I pay the bill for that because it's a federal law. So that's the only answer I can give you at this point. We'd have to study that to see what else effect it would have. But all those who own trucking companies, the CDL drivers, and that, the employer pays for that drug testing anytime it's required.
Thank you. Next is Representative Crouch.
Thank you. I actually had a bill several years ago requiring that any state public works projects require drug testing. The unions already do it, but also require drug testing of non-union contractors that have state public works projects. That bill did not get through. But I think that it is important, the drug testing, what you do, and I think it should apply to everyone that works on public projects that are paid for with state tax dollars.
Thank you. Next is Representative McNamara.
Okay, thank you. I would concur with Representative Bacon and just know that the importance of worker safety, of the safety of you on the job, and would hope that an employer and employees would be able to negotiate and agree upon who pays. And my assumption would be it would be the employer that would pay.
Y'all's not answering.
Thank you. The next is Representative Rican.
Y'all's not answering the question. I'm asking, are they, right now, the way our contracts say, we pay, the unions pay for the drug testing. Right. Now, I want to know who's going to pay for the drug testing. Does the union still have to pay for them? Or for everybody? Or are they going to be able to freeload and not pay dues like the bill's wanting to do now?
Okay.
That's the question. That's what I want the answer to.
Representative Rican.
I think that's one of those details regarding the right to work bill that is not out there for people to discuss and have a decision on. And we really should, because drug testing and training itself, that whole issue of training, right. The reason that we have such an outstanding trades in our country and in the state of Indiana is because of the training. And it's not just with them, it's with all of our unions and the training that they do. So I am very concerned about it. That bill, there has been no answer to that.
Thank you. Next is Senator Tom.
The issue about on this right to work, we're talking about taking away the dues to unions. That is their source of finance, their revenues. That's their lifeblood to unions. The money that goes into the trade unions, for example, on them dues, and folks, and this is for the people that support right to work. That money is dedicated strictly to the training centers. So those folks in whether they're plumbers or pipe fitters or steel workers, electrical workers, that they can earn their apprenticeships and their journeyman's and master's degrees. They're not given out lightly. It's just the same thing as a student at college pays for his education. That's what pays for these people to become excellent in their fields. And I don't want to see us take that away from that ability to be able to, for a person to become a good worker in their field. That's what we're talking about here. So that's why I don't support right to work. This is just one of the elements of it.
Thank you. Next is Senator Becker.
And I would just say that I think that is a $64,000 question, you might say, with this piece of legislation that we don't have the answer to. We don't know who would pay for the drug testing, and that's something that, if I understood you right, let's see, was it Steve? That unions, that you test everybody. It's not random. Is that right? Right. Okay, and so, pardon? You have random as well as everybody. Yeah, and I think that's a question that really needs to be determined, the answer, before we vote on a piece of legislation like this. And I also think the training programs are critically important for the development. And I have seen some of the training centers and the work that they do. And I would be very concerned about the loss of that expertise and that training, because it's not an easy process to go through. So those are questions that really do need to be answered before this piece of legislation is voted on.
Time. Thank you. The next speaker is Robert Adams. And please start making your way up to the microphone. Robert Adams. Okay, and his topic is to update, looks like TBI care. Robert Adams to update TBI care. TBI. Microphone, you have 2 minutes.
I believe Indiana has about 1.7 million traumatic head injured people. And I have a son that's traumatic head injured. And all of the care that he's had, most all the care he's had, once he was physically recuperated, has been out of state. The state is trying to get TBI care for people in state. This whole issue is kind of complex because traumatic head injured people progress through about 7 steps of recovery. So there's all kinds of different care that's going to be needed throughout the recovery process. Right now, Indiana doesn't have anything major to offer. And my son's caseworker is every month has to call people in Indiana looking for a place to move him back when there is no place. But it's something they have to do. They're wasting their time and energy and money doing that. Now, I know there's a committee studying traumatic brain injury right now. I'd just like to have an update on what's going on.
Thank you. We will now have responses from the legislators. I think we're going to start with Senator Becker this time.
We just heard that bill, and I can't, Mr. Adams, I can't give you the bill number, but we just had it in public health. I'm actually a co-author on the piece of legislation for traumatic brain injuries. And we, at the current time, Indiana spends $11 million a year for treatment outside the state. And what this bill does is it directs Family and Social Services as well as the State Department of Health to look at how we can get these services in state so that we don't spend the money out of state. That could bring jobs, more jobs. That would be a very creative way of bringing jobs back to our state for people that care for people with traumatic brain injuries. And one of the things that I did on this piece of legislation was ask for an amendment to add to the committee that will look at this a neuropsychologist that works in rehabilitation with brain injury patients, because it's critically important to have that kind of expertise as well. So we are working on that. It's a bill that has passed out of the Public Health Committee in the Senate and will now go to the floor for further consideration. And thank you for your input.
Thank you. Next is Senator Thomas.
Thanks, Robert. I'm not familiar with this bill that she's talking about, but I know that this summer I've had a lot of calls from individuals with health issues and how important that is, and I understand how important this is to you, so I'd be happy to keep a close watch on this and afford any help that I can in that, okay? Thank you.
Thank you. You're getting the hang of this. Representative Rican.
Thank you. I had a call and worked on this summer a gentleman who had an auto accident. The son had an auto accident, and because we didn't have the services in the state and they couldn't get the services outside of the state or wouldn't allow them at that point, he's been in the hospital on intensive care. I'm sure it's in the millions at this point, and it doesn't make any sense because he's not thriving in that environment. So I really do. I support what Senator Becker's doing, and I appreciate your comments. Thank you.
Thank you. Next is Representative McNamara.
Thank you for sharing your comments. I'm glad that it's being addressed and that something that can be done about it can hopefully help you in the long run. This summer, I had the opportunity to go to Washington, D.C. and meet with the director of all of the military's brain injury research center. And I would appreciate it if you'd stop by afterwards. I can give you her contact information. They're making some fabulous or miraculous research there with brain injuries from our military.
Thank you. Next is Representative Crouch.
Thank you. And, not only should our state tax dollars go to take care of those that need the help in other states, but those that need help need to be with their families. And I have supported and will continue to support addressing that issue so that your loved one can be near you and can get the care and the help that they need to thrive and to move forward.
Thank you. Representative Bacon.
Thank you. As I've said, with Senator Becker and Representative Crouch, we're on the Healthcare Committee study committee this summer, and that was one of the recommendations that we do that. And with the Senate bill coming out, as soon as it gets through that, then we'll move it through the House, and hopefully we'll get something accomplished and keep working on it. Thank you.
Oh yeah, you got the hang of this pretty quick. Okay, thank you. We will now go to the next issue. Our lucky winner is Kathy Engel, and the topic is, I don't know where she's at. There she is. Please make your way up to the microphone. Topic is support for comprehensive smoke-free. And that's House Bill 1149. House Bill 1149 supporting comprehensive smoke-free legislation. There's 2 minutes.
Thank you. I really won't even take 2 minutes. I would just like to ask you all to vote for comprehensive smoke-free air. If you're interested in helping lower health care costs, that's certainly one of the ways to not expose people to poisonous gases in the air. Please don't discriminate. Please make it the strongest possible, and it would be nice if it was comprehensive, completely comprehensive, but at least the fewest exemptions possible. Thank you.
Thank you. We will now go to legislative response, starting with Representative Bacon.
I'll see if I can get this done in a minute real quick. Comprehensive is a really tough word on this issue. I'm a respiratory therapist, which most of you know, and I treat what happens with folks with lung disease and from smoking. I'm in total agreement that we should, if at all possible, get rid of it. And we definitely need to, everything I do on this bill is to protect our youth and get away from secondhand smoke. But we have other issues involved also, which is the right of person to smoke if they want to, because it's still a legal drug. So it is not illegal. I understand the secondhand part of it. The bill this year, is, from what I've seen of it, is better than what I saw last year, and so I like it very well. It's not exempting the bars yet. I still think that may come up with the House vote. It does have smoking on the casinos, and the other issue that I have to worry about considering the casinos are that we did run on not raising taxes. LSA has told us the loss of revenue to the taxes is going to be a bad issue.
Thank you. Next is Representative Crouch.
Thank you, Kathy, for your work in this area. I did vote for that bill in Health Committee. And for those that are here, just to give you an idea of what that bill does, it prohibits smoking in public places, in enclosed areas of place of employment, in certain state vehicles, within 12 feet of a public entrance to a public place or an enclosed area of a place of employment. It allows smoking in certain gaming facilities, in cigar and hookah bars, fraternal, social, and veterans clubs, and tobacco stores. And then it has some other language in there. But that is what the bill is currently as it passed out of Health Committee. And it will go to the floor of the House, and we'll see.
Thank you. Next is Representative McNamara.
I asked her if there was any amendments added in committee. The issue for me, I voted for this last year as it went out of the House into the Senate. My concern is the exemptions piece and who is exempt and who is not. I believe it's up for hearing on Tuesday, maybe? I don't know, on second reading. So I'm comfortable with it, I would probably look to see if we could add 1 or 2 more exemptions for bars and those sort of thing. My only concern is the revenue loss. I told them on an economic level, it would take 3 years for us to recover a revenue loss with a comprehensive smoking ban. But I believe I can live with it the way it is right now, but I would probably vote for the amendments to include the bars and the other areas.
Okay, thank you. Good timing. Next, Representative Rican.
Thank you. And just for disclosure, Kathy's my sister-in-law. So I'm going to be a good girl here. She knows I'll go. I'll vote for the most comprehensive smoking legislation that we can get. And just to put that revenue into perspective, they're saying the estimated state revenue loss from the slot machine wagering tax imposed on the racinos as a result of the smoking prohibition would potentially total $10.6 million to $21.2 million annually. There is a real, we have to go into this with our eyes wide open, but it is extremely important. I support you. Thank you.
Thank you. Next is Senator Thomas.
Well, I guess if there's got to be somebody here to throw rocks at, it'd be me. Kathy, I've met with Martha Kane and all of them, and I've told her, and I'll tell you, I appreciate all the work you guys do in this, and I'd be happy, as always I've said, to assist you in any of the educational aspects that you guys do on the ills of smoking. But we're asking government to step in and mandate to people, especially businesses, to tell them what they can do and what they can't. And it bothers me a great deal. Right. The restaurant owners that have decided to go smoke-free, them and their patrons have found each other and are quite happy. The ones that like to have a place where they can go in and have a cheeseburger and smoke their cigarette and drink a beer, they have found themselves. When government gets involved in a lot of things, they contaminate it. It bothers me that we're asking government to ban something, to take control of our lives. At some point, I'm afraid that every one of us is going to find someone point a finger at us and says, I want this stopped and I want the government to stop you from doing it. At that moment, you'll wish there will be some legislator with the courage to stand between you and that government. So I hope you can understand my position on this too. I'm all about help, but I just can't support that.
Thank you. Next is Senator Becker.
I guess the issue, we in the Senate killed a bill last year in public policy, basically because we couldn't reach consensus, and it was really the American Cancer Society asked us to vote against the bill because it had too many exemptions to it. So I guess we'll just have to see what the House sends over. It will probably come to public policy in the Senate, on which I serve, and I know that the Senate leadership has said that they will consider a vote this year, but they want to see what the exemptions are. They're concerned about revenue, but I know Kathy could tell us this, and I've looked at these figures before, but there's also a cost to government for not having smoke-free places, because people die of cancer every day because they've been exposed to secondhand smoke, and so these are people that don't have an option, children in many cases as well. So those are some of the concerns about it. I'll just have to wait and see what the exemptions are and take a look at it. Be happy to have your input.
Thank you. It's time. House Bill 1001.
Thank you, Jim.
You have 2 minutes.
My name is Jim Gislason, and I've been a small business owner for 33 years. I'm a member of the Leadership Council of the National Federation of Independent Business, or NFIB, and have been a member since 1978. I am here as a member of the NFIB Leadership Council, representing over 14,000 small businesses in the state of Indiana, who provide the majority of the 2,739,000 jobs in the state. NFIB ballots its members on 4 or 5 issues twice a year. In 2010, the response to the right to work legislation was 90% in favor. The 2011 survey results were even higher, 90.47% in favor of right to work legislation. This is the highest total of support of any issue that I could remember. Indiana is missing out on many new jobs as site selectors choose to concentrate on right to work states and avoid those that are not. Small business needs more people working so they can sell goods and services and create more jobs for Indiana workers. A healthier Indiana economy will make a big difference for Indiana's small businesses. Passing right to work is one of the things we can do right now to improve our economic environment. I would urge the legislators here to help small business provide more jobs in Indiana by supporting right to work in HB 1.
Responses from the legislators. And this time I think we'll start with Senator Becker.
Actually, I think we've discussed this issue on both sides several times, so I think my answer is the same as it was before.
Okay, Senator Tom.
Yeah, I'll wade into this one too. Thank you, Jim, for that, and I do understand your position. I really do. I had a fellow from Elkhart, Indiana, though, this week emailed me. He's a small businessman, retailer, and his letter. And I'm sharing this with everybody just so you understand the dynamics of how everybody feels about this. His letter was asking me to oppose right to work because he feels that it will lower wages and have an impact on his business and on buying power. That was a legitimate concern. So I tell you, folks, I know we're not able to share with everything that's going on here today. There's not enough time. I wish there was. That's why parking lot's fine. But I'm telling you that there's a great deal to consider here. And on these site selectors, I've asked two questions I could not get an answer to. I asked, when we're told 30% of the companies don't come here because we're not right to work, I've asked 30% of how many? Was it 6? Was it 600? I was told that's confidential. They couldn't release it. I said, okay, would you tell me just some of the names of the companies? And I'm asking this as a legitimate because I need this. They said they couldn't release the names to me of those companies. That's the basis of the arguments on the other side. So I'm just saying, you've got to understand from our viewpoint, and all of those here, there's many more of us up there that have the same positions on this, both sides.
Time.
It's not just us.
Time. Thank you.
This is fair.
Representative Regan.
I think I've given my viewpoint. I think it is the other side of the story is extremely important as well, and it's the small businessman that talks to me and says that by the time we're going to bring the wages are lower because the jobs don't pay as what they should be paying as they're paying today. And I remember one gentleman who testified at our hearing last week or so who said that I'm being paid double here in Indiana what I'd be paid in Florida for the same work. We need people to have a living wage so that they will go to the small business and purchase their goods.
Thank you. Representative McNamara.
Thank you. I like Representative Bacon, didn't know what right to work was until I'm standing up there and Chuck's pounding at the Teamster Hall. You were pounding. You were hitting really hard. And you're saying, give me your... Okay, anyway. No, I didn't know what right to work was. Hadn't heard it. Didn't run on it. Didn't know anything about it. But I will say the one thing, if you can look at the miniature piece of good thing that has come out of this piece of legislation, it has afforded me the ability to learn what our unions do in our community. The union district managers have reached out to me and said to me, you know, we need to make a relationship with you so that we can get to know you. I really believe that had this legislation not come to us, that relationship wouldn't exist today. They wouldn't have reached out to talk to me. And through that, I found a real gem we have in our community. I've had the opportunity to go through the training centers and see what you do.
And time. Next is Representative Crouch.
Thank you, and I'd like to address the site selection part of your statement. I've sat in on hours and hours of testimony, read tons of surveys, opinions, statistics, and they're all over the board. And in fact, there was an economist that testified last Friday, and he said, you're going to hear all kinds of things, and depending on what your position is, you're going to have things to support that position. But a site selection consultant who was asked if he was for right to work, he said it doesn't matter. His opinion doesn't count. He actually works to try to place companies in locations. And he said the things that they look at are the tax structure, the workforce quality, quality of life, government incentives, and infrastructure. But some companies won't even look at a state and see if they have those, if they aren't right to work. Is that fair? Is it right? It is reality.
Thank you. Next is Representative Bacon.
Thank you. I'm a member of the NFIB, which you know and have been for at least 30 years, I know. Got the same survey, filled out the same survey, sent it in. So all of you need to know that. The NFIB has had this on an issue, so I'm addressing the issue there. And it's an issue of, do you support right to work, or you want it to be a right to work state? It's much more than that. Much, much more. I know that if I was an independent business, 20 years ago, without knowing anything about this, and someone sent me that same survey, I would have put, I want to be a right to work state, because I didn't know the issue. That would have been my survey answer. And as I said, I spent the last year surveying this myself, talking to my businesses in my community, and the small businesses, and the manufacturing. And it's all over the place here. Look, and this is what I've got to look at. Warwick County has made, Chamber of Commerce is neutral on this. The Vanderburgh County Economic Development is neutral on this. Southwestern Indiana Chamber of Commerce is not neutral on it. They're definitely pro for it. There are on both sides of this that we're looking at. So as I said, when we're finished with this, we will do what the district wants, and the state has other issues to look at in certain areas of the state.
Thank you. Thank you. We are in a situation where we only have one subject left that's not right to work. So what we're going to wind up doing is we're going to allow the person named Steve Herm to come forward and talk about making it harder to buy ingredients for meth. You need to limit yourself to that topic. So you need to stay on point. If you don't stay on point, I'll cut you off right away. Microphone is over there. You have 2 minutes. Then what we're going to wind up doing is each legislator, we're going to minute to respond to that, and we should have some time left. So the way we're going to do this is each legislator will get to make a 3-minute speech each after this particular topic is done. If there's any time left after that, then we'll just go to the open floor again or back to the cards. So, Mr. Herm, making it harder to buy ingredients for meth.
Thank you. Your name, sir?
Go ahead, you're on your time.
I just wanted to say I apologize. I'm very passionate about this subject, and it's showing. But anyway, I'll take my 2 minutes and talk. There is a bill out there to limit or to make a pseudoephedrine a prescription instead of being able to buy it over the counter. And I took some today. I've got a head cold. It works. But I do believe that it is way too easy for people to get these ingredients. And there's a plague in Vanderburgh County. Most of the house fires in the area, this summer were caused by people with their clandestine labs burning down. Right. But if I do have, can I ask one question? Do you feel this is an issue of public disclosure? Do you think that if the governor has commercials backing an issue and he floods the airways with it, do you think that the governor of any state should disclose to the people of the state where the money is coming from? If the governor is bringing outside issues into the state.
Sir, stay on point with meth, please.
With meth?
With meth. With making it harder to buy ingredients for meth.
Does anybody feel, any of my legislators feel like they are going to not support this? And do you think that the governor should disclose where the money's coming from? Thank you.
Okay, thank you. Now, I'm going to ask the legislators to limit their responses to harder to buy ingredients for meth. After we're done with meth, if you'd like to be done with meth, you got up to a minute each to do that. Then you'll each get 3 minutes. Then we'll go back to the audience again. Okay, starting with Representative Bacon.
Thank you. I'm going to get to start on this because it's my bill. And I'll try and do it in a minute. The bill that I have is 1071, and that is to give local areas, local government units, the ability to have a bill to take care of meth that is more stringent than the state unit. Right now it's been handed down and it's been put in public health. So it's a very simple bill. It changes 2 words in the language and will allow the local controls to do that if they want to, since we have the meth problem. They don't have a meth problem in Marion County. They have a cocaine problem. Meth dealers come to Marion County and try to set up labs. They're dead in 48 hours. So they don't have a meth problem. So we have a meth problem. So we need to take care of our problem and then allow us to do so. Right now it's there. It's in public health. We've asked for it to get moved to local ordinance, and so far the Speaker has not done that. So that's where I'm at on the meth bill. to give you the opportunity to help and do something for yourselves down here. So that's all I can say within my minute.
Thank you. Representative Crouch.
We did have that bill in Health Committee last year. It did not come for a vote. The bill that did come for a vote that I supported was implementing a statewide computer system that would allow pharmacists to go online and get real time on whether someone has purchased ephedrine or pseudoephedrine right then. And that just went into effect, and some states have been successful with that. Other states have been more successful with the prescription, and certainly I will support and take any steps I can to address the problem that is devastating our families here in Southwest Indiana.
Thank you. Next, Representative McNamara.
I appreciate being a co-author on Representative Bacon's bill, giving us the local decision and opportunities to do that. Meth certainly is an issue that I heard a lot about when I first got up to Indianapolis, because you see the homes catching on fire, the labs and that sort of thing. In fact, one caught on fire about less than half a mile from my home one day. So I am happy to help champion whatever it does to eradicate this problem from our community. And if that means making a prescription, then I'm 100% behind it. Thank you.
Thank you. Next is Representative Rican.
Yes, I think I am a co-sponsor, right? Aren't I? Correct, co-author. That's right. I thought I got on there. I'm on there. We need to do it. It's a safety issue. It's about our children. It's about our next door neighbor. You have no idea what's going on until it happens, and these are explosions. It's about safety for our firefighters and our police personnel as well. And I would tell you, if the governor had an ad that was against that, I'd want to know who was paying for it.
Senator Toms.
I had hoped that we would have had a couple of controversial questions today, but meth problem, heroin problem, vodka and gummy bear problem. We have a culture problem. And now it's up to the folks what they want. But here's my concern, is that we want to take this pseudoephedrine, this common cold medicine, that people buy it for legitimate reasons too. We want to put it over in the pile of prescription medicine, which is by far more abused. Prescription medicine is by far more abused than any illicit drug. We had a sheriff in Terre Haute just recently was arrested for obtaining prescription medicine. He's now in Clay County Jail. I'm concerned that we're going to take folks that are struggling right now to just pay their grocery bills, have money available to live in life, and we're going to force them to go to a doctor and get a prescription, which is going to jack the price up anywhere from $60 to $106 to get a piece of paper before they can get their common cold medicine. A medicine that just a few years ago you could just walk in and get it, go home and take your medicine. I'm not in favor of punishing good people for what bad people do. You got to understand, that's my concern about it.
Thank you. Next is Senator Becker.
I guess I know that Representative Bacon has a bill, and if they pass it, it would actually just allow the local community to decide that issue, and I think that's where it's best decided, so that people who live in this community can make their voices heard at the local level, because I really do believe that government closest to the people works the best, and so I would be supportive of moving that piece of legislation should it come over to the Senate, so that people right here can make that decision.
Thank you. We will go into a situation now and allow each legislator up to 3 minutes to pretty much talk about anything you want. You know, you may concentrate on whatever it is that will make my life easier, but that's my suggestion. But yeah, 3 minutes. After everybody does that, we'll see what kind of time we have left. And we'll start with Senator Becker.
Well, there's been a lot happening in Indianapolis, at least in the Public Health Committee. We have passed the brain injury bill out of public health in the Senate. I'm also authoring a bill on HIV testing, and we had a coalition working on that this summer. both advocates, people who are concerned, IU, health, Clarion Hospital, so that we can provide more HIV testing and medicine and treatment programs for people with HIV. And this bill has passed out of the Public Health Committee unanimously and also had the support of all the advocates, but mostly because we worked on it from last summer after we had a recommendation from the Health Finance Commission so that all the advocates, so that everybody involved in the issue could have their say and come up with a bill that everybody could support. I really think that's the way legislation should work, trying to bring people together rather than apart. So I'm very pleased with that piece of legislation. We also just passed a human trafficking bill, Senate Bill 4, that has passed the Senate unanimously. This is something that's critically important. What we have found is that in cities that have huge sporting events, we see the human trafficking of children as well as women into sexual slavery, so to speak. And it's not been addressed in the state of Indiana, but because of the Super Bowl, this is a piece of legislation that the governor supports, that both sides of the aisle support, that will help Indiana in dealing with the Super Bowl and the potential human trafficking that could happen as a result of the Super Bowl. We passed that piece of legislation. It had bipartisan authors, one both Republican, one Democrat. In fact, I think most of us in the Senate actually joined on that piece of legislation. It passed 48-0 and is now pending in the House of Representatives. So I think that's a very important piece of legislation as well, and I'm very pleased that we have seen that action take place. And I'll just stop there.
Okay. Thank you. Next is Senator Thomas.
Thank you. Just one little follow-up on that, Meth. I understand the position that police and fire departments have, and I just want to say that we have a daughter that's a state trooper, so I fully understand the danger aspects on that too. For myself, this session, I've had a few bills I've introduced, and I'm also involved in a few things too.
Not
And
even fucking right state representatives.
Okay.
Please allow the senator to speak. Thank you. Please allow the senator to speak. Thank you.
The Barnes decision will be something that will be discussed, I think, at Senate Bill 1 coming up this session. Also, assistance again for military families. I'm involved in that because as a veteran myself, I have a deep interest in the veterans in our state. I have a bill that is in reference to insurance premiums for buildings that have metal roofs because I think that's something that ought to be considered by companies that insure those buildings to consider giving a discount because those roofs rarely are ever involved in claims on wind or hailstorm damages, and those roofs certainly don't wind up in landfills. I think it's something the insurance ought to look at. Also on local government consolidations, that bill will be heard this coming week. I think there's about 5 or 6 bills similar. There may be a combination of these bills put together and come up with one bill. I did get a bill passed this past week on repealing a ban on switchblade knives. It's an antiquated law. The state police supports this bill, by the way. So for those who think that's not important, it is for those in the industry, in the knife industry, it is important. And people that like to have a knife that, if they're handicapped, they can only use one hand, they can have a knife that they can open. We'll get into that later if you want to talk to me about it. Another bill is the Department of Corrections has come to me about. It's a bill for the DLC to the companies that provide these tracking devices, GPS tracking devices for sex offenders, violent sex offenders. It would allow them immunities if the sex offender would cut the device off or do something that the company wouldn't be held liable. They wouldn't be exempt from defect or anything like that, but they wouldn't be held liable, and it would help DLC maybe get even more of these tracking devices. So I think it's a good measure. I'm going to tell you something, folks. What I've enjoyed about this most, you talk about representation. This whole summer, I wake up to phone calls, I go to bed with phone calls of people that's been calling and asking for help. That's what I really enjoy about this here. This summer, I've had a small businessman that had spent a year trying to get a simple permit from the state for his business. In 3 days, I got him that permit. He couldn't believe how quick it happened. I've had people that's had nightmare situations with Bureau of Motor Vehicles on getting some kind of a license or title for a vehicle. I've had department heads of these agencies in my office to explain to me why our citizens are having such a tough time on getting something done, why Homeland Security is so involved in our everyday lives. And I'll finish here. In Posey County, I just found out in Posey County there's no juvenile delinquency center. There's no juvenile home or anything like that. So when people are caught 3 o'clock in the morning, a juvenile is caught doing something wrong, there's no place to put them. I do have the DLCs coming in on February, and we're going to have a meeting with the team, the full team from DLC to help Posey County get something for those juveniles.
Next is Representative Regan.
Good job, Senator. He is really active. I'm going to talk to you a little bit about another issue, and that has to do with energy and a caucus that we're developing, Bipartisan Caucus. Senator Breaux is taking charge of this. I think many of you know I've been very active in the utility issue and very concerned about our bills. We pay the highest rate in the state of Indiana. Well, the last meeting that I had, and that, by the way, that will be all decided finally, I think, in February. I had a meeting this last weekend with Vectren, and they're going to be looking into some issues and some opportunities that maybe we can look at change in how we do business in the state of Indiana. Minnesota has developed something that is a lot fairer to folks. I would like to see that in addition to the decision making of the commission being just and reasonable, that they would add that term affordable, because right now that is not in the decision making process where the commission is. That's what you and I can afford. So the idea of increasing alternative energy opportunities, and we could do that and still they could make their profit, but also what about all these bills that aren't being paid? The defaults, the no pays. Believe me, you and I are ending up paying those. That is happening. We need to look at what the cost is, and maybe there's a better way to address that so that people can have heat and be cool in the summer. And there are ways that other states are addressing that. So we want to educate, and anybody with ideas, love to have them, especially the League of Women. I know you've got some. Thank you.
Thank you. Next is Representative McNamara.
Thank you. I have a few bills that I hope will help local community, Vandenberg community in particular. I have one that's for county reimbursement for death penalty cases. Right now, if a county files a death penalty case, they're reimbursed at 50%. So whatever the costs are, the community picks up the rest of the money. What I've proposed is that we up that to 80%. Hopefully will that bill get heard. What it does, right now there's a $5 fee that anybody who's convicted of anything from, speeding ticket all the way up to the highest conviction you can get. I'm asking for, this is out of my mouth, a $1 raise in that fee. That'll be able to give 80% reimbursement to our communities if they file a death penalty case. Another one that Representative Crouch and Representative Messmer and myself have worked on is tax exemption for military pension benefits. And the hope with that particular piece of legislation is to give an exemption to the military pension benefits so that we can encourage our military veterans to stay here or encourage others to move here. In particular, we have Crane Naval Base up there, and we have a lot of those folks who could stay in Indiana but choose not to because we don't give special benefits. I believe it's Georgia. Help me. Georgia and Alabama have seen great retention of veterans by giving that tax exemption benefit to them. And my other particular issue I've been asked to take by the Department of Corrections is, again, looking at juvenile issues. Right now, if we have a juvenile that's been charged and sentenced as an adult, at age 18, they are automatically sent to an adult prison. In a lot of respects, the DFC or Department of Corrections doesn't have the ability to hold on to that particular individual. Let's say they're not physically mature enough, mentally mature enough, or that sort of thing to be placed in an adult prison. This would give the Department of Corrections the ability to evaluate an individual basis and determine whether or not that particular individual needs to go to the adult prison, or they can be held in juvenile until they're 21. That gives that particular things. There's a one that I was. Did you say I was done? Okay. There's okay. All right. Thank you. There's one other one I was asked to join on, and that's pretty interesting to me right now, and especially my nephew. It's an early probationary license for students with good grades. If a student has achieved a 3.0 and the preceding their 16th birthday, they can actually get their driver's license a little bit earlier. And I know that would help out parents a lot about... Oh, you don't like that? No? You don't like that?
Time.
Okay.
That's probably a good time.
Trying to reward the kids. That's what I was trying to do.
Thank you. Next is Representative Crouch.
Thanks for letting me know.
Thank you all very much. There have been 786 bills filed in the House and Senate. And as Vice Chair Ways and Means, that is the Budget Appropriations Committee, we have heard a number of bills. And we passed out one bill this past week, and that is providing a 13th check for retired teachers. And I believe that Senator Becker is also authoring that bill in the Senate. In addition, we looked at funding changes for Central Dispatch to provide additional funding and try to capture some monies from throwaway phones and from cell phones. And it's interesting, approximately 83% of Hoosiers have cell phones. So in Vanderbilt County, that means there's about 145,000 people that have cell phones. We also heard a bill on historic preservation tax credit to increase the credit for those that invest in fix-up and historic preservation from $450,000 to $10 million. I have a couple of bills that are being heard this week. One is electronics meeting bill, which will allow those board members of state commissions and boards to be able to participate if the board chooses to allow them to participate electronically. That'll help establish a quorum and continue to allow government to move forward. But, you know, there are so many bills, and I appreciate the input that all of you have provided. And there are no easy answers, and I recognized a long time ago that every vote I take, there's probably going to be people unhappy with that vote. The one thing, though, that two things I'd like to do. One, we have, through an error, the state has discovered that they now have an additional $300 million, and that is going to come up for discussion in Ways and Means. And I want to ask you all, there are many things that have been suggested. One of the things is we should save part of that money because who knows what's going to happen in the future. One part is we should give that money back to the taxpayer because that's what we found. And one option is to try to restore some funding for education. So, if I may, how many of you believe that we should save some of that for emergencies in the future if we have an economic downturn? Show of hands. Yeah. Thank you. How many believe that we should give back to the taxpayer? And they've estimated that would be about $50 in general. How many believe we should help or get back and restore education funding? Thank you for that input. Now, all these things are important, but I want to tell you, ladies and gentlemen, what's really important. What's really important is we have a young gentleman here today, Brian Barnhart, who served 3 tours in Iraq defending our country and has been recognized and received awards for that service. And that truly is what's important, and that is what allows us to be here today. Brian?
On the meth issue, all of you, I want you to remember what we're trying to do with this. We are not trying to interfere and impede anyone from getting pseudoephedrine. Okay? Jim and I talk about this all the time, and we have lots of discussions, and we are good friends, and we love fighting over it. So we'll continue to do that. Don't worry about it. But it's the manufacturing that I'm after. I cannot sit here and allow another child to be killed in the manufacturing process of this drug. I will do everything I can to stop that. And if that includes putting it as a prescription, I'll do it. We only have laws for one reason, to protect the innocent and for safety issues. It's the only reason we should be making them to begin with. So that's what I'm after, and that's what I'm doing. I'm very passionate about that. So The other things, been working on jobs, job production. That's my main thing I ran on last year, and I'm still working on that. We need to continue to do everything we can to bring jobs to Indiana and southwestern Indiana and my district. And we're doing a really good job down here. We have less of our unemployment rate down here is much better than the overall state. Warren County 6.5%. Vanderbilt County's 7.2, Gibson 7.4. So overall, we're about 7%, and we are better than the rest of the state. We're doing a pretty good, decent job down here, and we're going to continue to do that. And I'm also working on trying to find ways legislatively, and it's very difficult to do. You can find ways to bring jobs, and that's what we're concerned about. I'm more concerned about keeping the ones I've got. I've got 25 employees that I've had for the last 32 years. And every day I get up and have to worry about keeping my business going and keeping them in a job and getting a paycheck. So that's what I'm after. Now that's more difficult to do than bringing new jobs. It really is, because the legislation's all there for new employment. We need to get more laws on the books to help the current employers keep the ones that they have, the good ones we want to do. So that's what I will continue to do. And as I will continue to listen, I really appreciate all of you coming here. I wish every time we have a meeting here, no matter what, as long as I'm a legislator, I want this room filled. And I really appreciate all of you. Thank you.